HHA Practice Test 2026 Home Health Aide Certification Exam. Question 1. When giving a bed bath, how often should the water be changed? Option A, as often as needed to have warm, clean water at all times. Option B, just once. Option C, only after washing the perineal area. Option D, only after washing the front half of the patient. The correct answer is option A, as often as needed to have warm, clean water at all times. Question 2. Which of the following items is used in the prevention and treatment of bed sores or pressure sores? Option A, rubber sheets. Option B, air mattress. Option C, emesis basin. Option D, arm restraints. The correct answer is option B, air mattress. Question 3. Proper feeding techniques include: Option A, just 1 spoonful per bite. Option B, feed the patient slowly and make sure all food is swallowed. Option C, feed the patient while laying flat on the bed. Option D, allow the spoon to go to the back of the tongue. The correct answer is option B, feed the patient slowly and make sure all food is swallowed. Question 4. If a client is wearing anti-embolism stocking, what would be an important thing to assess for? Option A, ultrasound for deep vein thrombosis. Option B, tingling or lack of sensation. Option C, bounding pulses. The correct answer is option B, tingling or lack of sensation. Question 5. When performing these health skills on a client, it is always important to: Option A, have consent from the client. Option B, wash your hands before and after. Option C, explain exactly what you are doing. Option D, all of the above. The correct answer is option D, all of the above. Question 6. What is not a sign or symptom of dehydration? Option A, light-colored and diluted urine. Option B, weakness and thirst. Option C, dried mucous membranes. Option D, rapid pulse and low blood pressure. The correct answer is option A, light-colored and diluted urine. Question 7. Which of the following is the most appropriate practice to promote good skin care in the elderly? Option A, keep the skin clean and well moisturized. Option B, apply alcohol to moist areas of the skin. Option C, wash daily with scented soaps. Option D, all of the above. The correct answer is option A, keep the skin clean and well moisturized. Question 8. When taking a client's pulse, you should take it for how long? Option A, about 15 seconds. Option B, 1 minute. Option C, 30 seconds. Option D, 2 minutes or more. The correct answer is option B, 1 minute. Question 9. Mr. Smith, a client with dementia, has become very agitated. Which of the following suggestions would be helpful? Option A, stay calm. Option B, offer diversion and/or entertainment. Option C, be agreeable. Option D, all of the above. The correct answer is option D, all of the above. Question 10. In giving foot care to a diabetic client, the home health aide should not do which of the following? Option A, clean under the toenails. Option B, cut the toenails. Option C, soak the feet for more than 5 minutes in a basin of warm water. Option D, put lotion on the feet after drying them. The correct answer is option B, cut the toenails. Question 11. Primary symptom for a urinary tract infections, UTI, is: Option A, yellowing of the skin. Option B, pain or burning during urination. Option C, high urination output. Option D, chills. The correct answer is option B, pain or burning during urination. Question 12. A client complains of intense pain in the chest that goes down the arm and is sweating profusely. The home health aide should: Option A, call for emergency help immediately. Option B, massage the chest and arm. Option C, assist the client back to bed. Option D, call your agency. The correct answer is option A, call for emergency help immediately. Question 13. What is a normal systolic blood pressure level? Option A, 80. Option B, 120. Option C, 140. Option D, 60 to 90. The correct answer is option B, 120. Question 14. Urinary leg bags are used for: Option A, catheterized male clients. Option B, catheterized clients who are up and out of bed. Option C, catheterized clients who are confined to bed. Option D, catheterized clients who have a decreased urinary output. The correct answer is option B, catheterized clients who are up and out of bed. Question 15. As a home health aide, what can you do for a client's minor burn as an emergency procedure? Option A, use cool water over the burned area. Option B, apply butter on the burned area. Option C, cover the area with a dry dressing. Option D, all of the above. The correct answer is option A, use cool water over the burned area. Question 16. Before helping a client into or out of a wheelchair, which of these actions is necessary? Option A, have the brakes unlocked and leave the footrests down. Option B, lock the brakes and fold the footrests up. Option C, have the brakes unlocked and the footrests up. Option D, lock the brakes and leave the footrests down. The correct answer is option B, lock the brakes and fold the footrests up. Question 17. When a client has been drinking fluids, how long do you wait before taking an oral temperature? Option A, 10 to 15 minutes. Option B, 35 to 45 minutes. Option C, 5 to 10 minutes. Option D, about an hour. The correct answer is option A, 10 to 15 minutes. Question 18. 96.6 degrees is a normal temperature if taken. Option A, by mouth. Option B, by axilla. Option C, by rectum. Option D, by ear. The correct answer is option B, by axilla. Question 19. Which of the following is a correct measurement of urinary output? Option A, 40 ounces. Option B, 2 cups. Option C, 300 cubic centimeters. Option D, 1 quart. The correct answer is option C, 300 cubic centimeters. Question 20. Which temperature should you report immediately? Option A, an oral temperature of 98.4 degrees Fahrenheit. Option B, a rectal temperature of 99.6 degrees Fahrenheit. Option C, an axillary temperature of 99.6 degrees Fahrenheit. Option D, an oral temperature of 99.0 degrees Fahrenheit. The correct answer is option C, an axillary temperature of 99.6 degrees Fahrenheit. Question 21. Mr. and Mrs. Williams, both in their 70s, are distressed about changes that are affecting their lives. Which of the following would not be stressful? Option A, positive relationships with family and friends. Option B, a change in Social Security benefits. Option C, one of them is diagnosed with a terminal illness. Option D, moving from their home to a retirement community. The correct answer is option A, positive relationships with family and friends. Question 22. A client in your care is frustrated, upset, and raising his voice in complaint. Which of the following is the best response? Option A, walk away from the patient in an effort to show you won't tolerate their behavior. Option B, ask him, her to lower their voice in courtesy to others who are getting upset. Option C, report the incident to the supervising nurse. Option D, offer support and care using a comforting and calming manner. The correct answer is option D, offer support and care using a comforting and calming manner. Question 23. You may encounter clients who are anxious or feeling unsettled about either their circumstances or surroundings. The best response in dealing with anxiety is: Option A, turn on the radio or television to distract the client from their immediate thoughts. Option B, open the shades to let in light and brighten the surroundings. Option C, leave the room so they can regroup and refocus in private. Option D, speaking in a calm voice and exhibiting a calm and comforting demeanor. The correct answer is option D, speaking in a calm voice and exhibiting a calm and comforting demeanor. Question 24. You notice a change in a client's mental condition. The best course of action is to: Option A, report the change immediately to the nurse. Option B, try to use a sense of humor to lighten the mood of the client. Option C, ask the client if they have noticed a change in his or her personality. Option D, plan to spend extra time with this client as they may need more assistance than normal. The correct answer is option A, report the change immediately to the nurse. Question 25. Which of the following is not a sign of depression? Option A, increased amount of time sleeping. Option B, withdrawal. Option C, a decrease in appetite. Option D, the resident's interest in doing social activities at the facility increases. The correct answer is option D, the resident's interest in doing social activities at the facility increases. Question 26. A client in your care has just received news of a death in the family. What is the best way to assist them with the grieving process? Option A, remind the client that death is inevitable. Option B, suggest that the client get their mind off of things by thinking of something pleasant. Option C, tell the client about an experience you had with death and what helped you cope with it. Option D, spend some time with the client, particularly offering support if they wish to talk about it. The correct answer is option D, spend some time with the client, particularly offering support if they wish to talk about it. Question 27. When caring for a dying client, the home health aide should: Option A, keep the room dark and quiet. Option B, allow client to express his/her feelings. Option C, change the subject if client talks about death. Option D, contact a minister, priest, or rabbi. The correct answer is option B, allow client to express his/her feelings. Question 28. Communication is defined as: Option A, exchanging information with others. Option B, stating your feelings and facts. Option C, writing or drawing. Option D, giving your opinion. The correct answer is option A, exchanging information with others. Question 29. Clients sometimes express religious beliefs with which the HHA does not agree. In dealing with these situations, which should you use as a guide? Option A, clients have a right to their own beliefs, which should be respected. Option B, clients should be told not to discuss their beliefs with aides. Option C, should explain their beliefs to clients. Option D, pretend to have the same beliefs that clients have. The correct answer is option A, clients have a right to their own beliefs, which should be respected. Question 30. Your client catches you off guard with a comment that is sexual. Your best response would be, Option A, let the client know that the comment is not acceptable to you. Option B, laugh and change the conversation to a different subject. Option C, make a humorous comment. Option D, walk away and pretend you did not hear it. The correct answer is option A, let the client know that the comment is not acceptable to you. Question 31. Which of the 5 senses is the last a client loses when dying? Option A, touch. Option B, sight. Option C, hearing. Option D, taste. The correct answer is option C, hearing. Question 32. Mr. Smith makes you uncomfortable because of sexual statements. How should you handle this situation? Option A, tell him that it is unacceptable behavior and call your supervisor. Option B, tell him to keep his hands to himself. Option C, tell him that you will tell his family. Option D, push his hands away and tell him to stop it. The correct answer is option A, tell him that it is unacceptable behavior and call your supervisor. Question 33. A patient is trying to tell you something but it doesn't seem to make any sense. In this case you should, Option A, watch the body language and facial expressions to help decipher what the patient is trying to say. Option B, ignore it since it probably is irrelevant. Option C, send for a nurse. Option D, smile, nod and act as if you understood. The correct answer is option A, watch the body language and facial expressions to help decipher what the patient is trying to say. Question 34. When speaking to a client who is hard of hearing and does not wear a hearing aid, you should, Option A, face the client when speaking to him or her. Option B, speak as loud as you must in order to be heard. Option C, speak slowly and clearly. Option D, all of the above. The correct answer is option D, all of the above. Question 35. When a client, caregiver, or coworker makes you angry, you should, Option A, tell him or your true feeling. Option B, respond sharply. Option C, think before answering and respond tactfully. Option D, leave the room. The correct answer is option C, think before answering and respond tactfully. Question 36. A client's family tries to tip you $50 for all the work you have done. A home health aide should, Option A, split the tip, 50/50ths, with the nurse. Option B, politely refuse the tip. Option C, take the money and thank them. Option D, donate the tip to charity. The correct answer is option B, politely refuse the tip. Question 37. Another word for forcing a client to do something against their will is, Option A, consequences. Option B, collusion. Option C, coercion. Option D, conspiracy. The correct answer is option C, coercion. Question 38. Choose the example below that would not be considered neglect. Option A, forgetting to move an immobile resident enough to keep them from getting bed sores. Option B, leaving clutter on the floor where a resident walks. Option C, not staying on the floor once you've clocked in. Option D, forgetting to provide your resident with enough water in a timely manner. The correct answer is option C, not staying on the floor once you've clocked in. Question 39. Which of the following could cause a home health aide to be charged with battery? Option A, administering medications. Option B, using restraints on a patient without a physician's order. Option C, ignoring or delaying a response to a client's call for help. Option D, raising a hand to threaten a slap. The correct answer is option B, using restraints on a patient without a physician's order. Question 40. A HHA threatens to slap a client if they don't stop yelling. This is classified as, Option A, assault. Option B, battery. Option C, slander. Option D, libel. The correct answer is option A, assault. Question 41. You observe a coworker sexually harassing a client and choose to ignore it. This is an example of, Option A, cease and assist. Option B, aiding and abetting. Option C, passive aggression. Option D, libel. The correct answer is option B, aiding and abetting. Question 42. A client's family is visiting when you arrive on duty and one of them hands you an envelope that contains a thank you card and money in appreciation for your care of their loved one. The best response is, Option A, accept the gift and be sure this client gets extra attention so they know you are appreciative. Option B, accept the gift and then purchase a gift for the client's birthday. Option C, thank the family but tell them you must decline until you can check with your supervisor. Option D, accept the gift and then check with your fellow colleagues about how they handled similar situations. The correct answer is option C, thank the family but tell them you must decline until you can check with your supervisor. Question 43. When a grease fire occurs, you can, Option A, use a fire extinguisher to put it out. Option B, smother it with a lid. Option C, pour baking soda on it. Option D, all of the above. The correct answer is option D, all of the above. Question 44. When working in a kitchen it is important to always practice good safety. Which of the following is not an appropriate safety measure? Option A, clean all spills immediately. Option B, refrigerate warm food only after it has cooled. Option C, keep drawers and cupboards tightly closed. Option D, air dry dishes after washing them, no towel drying. The correct answer is option B, refrigerate warm food only after it has cooled. Question 45. Proper safety techniques when ambulating a client include: option A, monitoring client for fatigue/dizziness. Option B, move at a slow and controlled pace. Option C, ensuring client is wearing rubber-soled slippers. Option D, providing support using a gait belt. The correct answer is option E. Question 46. When transferring a client from a bed to a wheelchair, best practices include: option A, record the move in case the client falls. Option B, assist the client into a sitting position at the side of the bed, then move. Option C, use a sheet to slide the client off the bed and onto the wheelchair. Option D, make sure the client is at the foot of the bed. The correct answer is option B, assist the client into a sitting position at the side of the bed, then move. Question 47. A client is receiving oxygen through a nasal tube. You would perform all of the following safety precautions except: option A, make sure there are no kinks in the tube, S. Option B, turn off the oxygen at mealtimes. Option C, give oral hygiene as directed by your supervisor. Option D, post a sign and do not allow smoking in the client's room. The correct answer is option F. Question 48. In case of an emergency, the most important number to call is: option A, a family member. Option B, the doctor. Option C, the emergency medical service. Option D, your agency. The correct answer is option C, the emergency medical service. Question 49. You arrive at a client's home that lives alone. He does not answer the door when you knock and the door is locked. What do you do first? Option A, call the emergency medical service. Option B, call the client's family. Option C, call the agency and report your findings. Option D, try to gain access through a window. The correct answer is option C, call the agency and report your findings. Question 50. It is important to share your personal life with the client so that they can know you better. Option A, true. Option B, false. The correct answer is option B, false. Question 51. Mr. Jones is on a low cholesterol diet. This means that he should not eat: option A, pizza. Option B, steak. Option C, rice. Option D, peanut butter. The correct answer is option B, steak. Question 52. A non-sterile dressing is one that is: option A, dry. Option B, wet. Option C, bactericidal. Option D, clean. The correct answer is option D, clean. Question 53. When a client complains of pain, what should the health aide do first? Option A, ask the client to describe the pain. Option B, change the client's position. Option C, offer the client a warm cup of milk. Option D, call the client's doctor. The correct answer is option A, ask the client to describe the pain. Question 54. Which of the following are true about canes, walkers and crutches? Option A, they must have rubber tips to prevent slipping. Option B, they must be fitted to the patient. Option C, clients must learn to use each. Option D, all the above. The correct answer is option D, all the above. Question 55. A client accuses a home health aide of taking $10 without permission. The aide has not taken the money but the client refuses to believe her. What should the health aide do? Option A, notify the health aide's supervisor. Option B, ask the client why the aide is being accused. Option C, ask other aides who care for the client if they took the $10. Option D, offer to give the client $10. The correct answer is option A, notify the health aide's supervisor. Question 56. If a health aide has bad breath or body odors, who is the least likely to be aware of it? Option A, the client's family. Option B, the supervisor. Option C, the client. Option D, the aide. The correct answer is option D, the aide. Question 57. The term flex means: option A, strain. Option B, protect. Option C, bend. Option D, twist. The correct answer is option C, bend. Question 58. Which of the following are considered a system? Option A, epithelial. Option B, circulatory. Option C, digestive. Option D, respiratory. The correct answer is option A, epithelial. Question 59. What is the primary reason for covering your mouth and nose when coughing or sneezing? Option A, to avoid getting snot sprayed all over other people. Option B, to avoid injury to the inside of the nose and mouth. Option C, to prevent the escape of bad smells. Option D, to prevent the spread of germs. The correct answer is option D, to prevent the spread of germs. Question 60. Abusers always know that they are being abusive. Option A, true. Option B, false. The correct answer is option B, false. Question 61. Symptoms of shock include: option A, cool, moist skin and rapid, weak pulse. Option B, excessive thirst and frequent urination. Option C, increased urinary output accompanied by severe pain. Option D, flushed skin and fever. The correct answer is option A, cool, moist skin and rapid, weak pulse. Question 62. Nonverbal communication can provide up to. Option A, 60% of typical communication. Option B, is not communication. Option C, 30% of typical communication. Option D, 90% of typical communication. The correct answer is option D, 90% of typical communication. Question 63. Learning requires the brain to. Option A, remove less used information to make space for new information. Option B, find unused neurons for recording. Option C, create new neurons and neural pathways. Option D, be sleeping. The correct answer is option C, create new neurons and neural pathways. Question 64. A routine urine specimen should be collected. Option A, anytime. Option B, when the client first awakens. Option C, before a meal. Option D, at 7 a.m. The correct answer is option A, anytime. Question 65. Babies and the very young are motivated mostly by blank needs. Option A, self-actualization. Option B, physiological. Option C, psychological. Option D, self-esteem. The correct answer is option B, physiological. Question 66. Sometimes a client may share religious beliefs and opinions which the home health aide does not agree with. What is the correct approach in dealing with such a situation? Option A, aide should pretend to agree with the beliefs the client has. Option B, aide should patiently explain their beliefs to the client. Option C, clients should be told not to discuss their religious beliefs with health aides. Option D, clients have a right to their own religious belief, and these rights should be respected. The correct answer is option D, clients have a right to their own religious belief, and these rights should be respected. Question 67. We obtain data from the external world through. Option A, data banks. Option B, our brains. Option C, our senses. Option D, study. The correct answer is option C, our senses. Question 68. Maintaining a wide base of support means. Option A, keep your feet apart. Option B, turn with the lower back. Option C, keep your feet close together. Option D, keep your knees and hips locked. The correct answer is option A, keep your feet apart. Question 69. Microbes are. Option A, all of the above. Option B, are very small. Option C, are the most numerous life form on the planet. Option D, everywhere. The correct answer is option A, all of the above. Question 70. The reason for covering a burn with a clean cloth before going to the hospital for treatment is to. Option A, relieve the pain. Option B, keep the victim from seeing the burn. Option C, prevent the victim from putting something harmful on the burn. Option D, keep the area free of germs. The correct answer is option D, keep the area free of germs. Question 71. If you do not know how to do an assigned task, you should. Option A, call another health aide for help. Option B, ask the client how she prefers to have it done. Option C, call your supervisor and ask for help. Option D, follow the instructions in the procedures manual. The correct answer is option C, call your supervisor and ask for help. Question 72. A client who is unable to move needs to have his position changed every. Option A, 4 hours. Option B, 2 hours. Option C, 8 hours. Option D, 30 minutes. The correct answer is option B, 2 hours. Question 73. The first principle of healthcare is. Option A, do as you are told to do. Option B, love your neighbor as yourself. Option C, do good and heal. Option D, do no harm. The correct answer is option D, do no harm. Question 74. Why is it important that a client have good mouth care? Option A, the saliva in the mouth is a source of stomach juices. Option B, bacteria in the mouth can cause tooth decay and gum infections. Option C, poor oral hygiene interferes with the sense of smell. Option D, poor oral hygiene causes more saliva to be made. The correct answer is option B, bacteria in the mouth can cause tooth decay and gum infections. Question 75. According to Maslow, motivational needs change with changes in. Option A, randomly and differently for each person. Option B, health, family situations and finances. Option C, depend on how they are determined by governments. Option D, don't change. The correct answer is option B, health, family situations and finances. Question 76. The basic types of pathogens include. Option A, bacteria, viruses, cancers, rodents. Option B, do as you are told to do. Option C, bacteria, viruses, fungi, parasites. Option D, bacteria, viruses, fungi, cancers. The correct answer is option C, bacteria, viruses, fungi, parasites. Question 77. Another term for heart attack is. Option A, pulmonary embolism. Option B, myocardial infarction. Option C, ischemia. Option D, cerebrovascular accident. The correct answer is option B, myocardial infarction. Question 78. pathogens in food can be killed by? Option A, irradiation. Option B, all the above. Option C, cooking. Option D, saliva in the mouth and acid in the stomach. The correct answer is option B, all the above. Question 79. Good sources of protein are: Option A, potatoes and noodles. Option B, apples and oranges. Option C, green salad and cooked greens. Option D, beans, peanut butter, and eggs. The correct answer is option D, beans, peanut butter, and eggs. Question 80. Customer service satisfaction. Option A, pertains only to the client in the home. Option B, will ensure the client's return for service and tell others about the agency. Option C, does not involve responsibility of the home care worker. Option D, does not affect agency policies for training its employees. The correct answer is option B, will ensure the client's return for service and tell others about the agency. Question 81. Abuse may be: Option A, structural, levels 4 and 5. Option B, always happens, it's part of dealing with uncertainty. Option C, financial, emotional, or physical. Option D, never happens and shouldn't concern the caregiver. The correct answer is option C, financial, emotional, or physical. Question 82. After Mrs. Thompson dies, her husband wishes to share his feelings and emotions. The aide should: Option A, tell him he should see a counselor. Option B, change the subject. Option C, listen to him and comfort him. Option D, tell him to speak to the aide's supervisor. The correct answer is option C, listen to him and comfort him. Question 83. Healthcare workers should wash their hands. Option A, when necessary during the shift. Option B, at least once during each shift. Option C, at the beginning of the shift. Option D, between every procedure or client. The correct answer is option D, between every procedure or client. Question 84. ADL means: Option A, all dead and living. Option B, association of drugs and licensing. Option C, is not communication. Option D, activities of daily living. The correct answer is option D, activities of daily living. Question 85. Physiological needs include: Option A, food and water. Option B, psychological health. Option C, friends and family. Option D, exercise and nutrition. The correct answer is option A, food and water. Question 86. Non-pathogens are: Option A, viruses that cause infection and disease. Option B, none of the options are correct. Option C, microbes that cause infection and disease. Option D, bacteria that cause infection and disease. The correct answer is option B, none of the options are correct. Question 87. Difficulty in breathing is called: Option A, Cheyne-Stokes respiration. Option B, apnea. Option C, orthopnea. Option D, dyspnea. The correct answer is option D, dyspnea. Question 88. Meeting your client's level 2 needs includes ensuring: Option A, nutrition, water and pain relief. Option B, safety and regular physician visits. Option C, all of the above. Option D, hobbies and exercise. The correct answer is option B, safety and regular physician visits. Question 89. Which of the following may be an early warning sign of cancer? Option A, a sudden increase in weight. Option B, a loss of hearing. Option C, a sore that does not heal. Option D, difficulty in bending a joint. The correct answer is option C, a sore that does not heal. Question 90. Meeting your client's level 1, physiological, needs includes ensuring: Option A, hobbies and exercise. Option B, safety and regular physician visits. Option C, good family relationships. Option D, nutrition, water and pain relief. The correct answer is option D, nutrition, water and pain relief. Question 91. When preparing for a lift or transfer: Option A, release all brakes to permit for easy movement. Option B, our senses. Option C, check the bed, chair, room and floor. Option D, keep extra furniture nearby for support. The correct answer is option C, check the bed, chair, room and floor. Question 92. Useful techniques to control your nervousness or fear when in front of an audience include: Option A, all of the above. Option B, focus on the listener, they have their own reasons for attending. Option C, be prepared, know your material. Option D, focus on the message, it's not about you. The correct answer is option A, all of the above. Question 93. Common problems facing the elderly population include: Option A, not being familiar with and not having the ability to learn new technology and new systems. Option B, the fact that most elderly live in nursing homes and assisted living facilities. Option C, living at home and receiving home health care means they will not live in poverty. Option D, remaining in their homes and maintaining their independence. The correct answer is option D, remaining in their homes and maintaining their independence. Question 94. A home health aide works in the home of their client Mrs. Thompson, who is terminally ill. One day a neighbor asks the health aide if Mrs. Thompson is very ill. how should the health aide respond? Option A, I'm sorry, I cannot discuss Mrs. Thompson. Option B, how do you know Mrs. Thompson is so sick? Option C, yes, Mrs. Thompson is very ill. Option D, Mrs. Thompson is doing as well as can be expected. The correct answer is option A, I'm sorry, I cannot discuss Mrs. Thompson. Question 95. This pressure sore prevention device redistributes pressure on a timed automatic basis. Option A, water mattress. Option B, foam ring. Option C, egg crate. Option D, air mattress. The correct answer is option D, air mattress. Question 96. Making a stable center of gravity means. Option A, keeping the center of gravity low. Option B, bend at knees and hips. Option C, keeping your back straight. Option D, low center, straight back and bend with knees and hips. The correct answer is option D, low center, straight back and bend with knees and hips. Question 97. When you take vital signs, option A, you record and report only abnormal vital signs. Option B, you understand they reflect the state of health of the body. Option C, you understand that vital signs report all bodily functions. Option D, you can estimate current readings if you know the previous readings. The correct answer is option B, you understand they reflect the state of health of the body. Question 98. Signs of infection should be reported to a supervisor. Which of the following are not signs of infection? Option A, pain. Option B, redness or swelling in an area. Option C, elevated temperature. Option D, increased appetite. The correct answer is option D, increased appetite. Question 99. Delirium in the elderly is always accompanied by fever. Option A, true. Option B, false. The correct answer is option B, false. Question 100. Which one of the following is a routine responsible of a home health aide? Option A, providing respite care for the wife of a client with dementia. Option B, picking up a client's prescription at the drugstore. Option C, grocery shopping for the family. Option D, washing the windows of the home. The correct answer is option A, providing respite care for the wife of a client with dementia. Question 101. One of your clients is turning 90 next week, and his family has invited you to attend his birthday party. What should you do? Option A, accept the invitation, and take a card or a gift to the party. Option B, decline the invitation, but give the client a card or gift during your next scheduled visit. Option C, decline the invitation after thanking the family for inviting you. Option D, accept the invitation, but avoid bringing a card of gift to the party. The correct answer is option C, decline the invitation after thanking the family for inviting you. Question 102. You are scheduled to work today, but the weather is beautiful and your best friend is begging you to take the day off and go to the beach with her. What should you do? Option A, ask your friend if she would be willing to go with you in the afternoon. You will take care of all your scheduled clients in the morning, and then you will be free to go. Option B, call the case manager on your way to the beach and tell her that you will not be able to visit your clients today. This will allow the case manager to find another aide to cover for you. Option C, tell your friend you are sorry, but you cannot go to the beach today. Option D, call each of the clients who you are scheduled to visit and ask them if it would be okay if you came tomorrow instead. The correct answer is option C, tell your friend you are sorry, but you cannot go to the beach today. Question 103. Why is documentation a very important responsibility of the home health aide? Option A, documentation is the main way that the members of the home healthcare team communicate with each other about the care given to the client and the client's condition, and the home health aide has the most frequent contact with the client. Option B, documentation provides information that is used to determine if a client is recovering or getting worse. Option C, documentation of all care provided is needed to justify continued payment for home care services. Option D, all of the above. The correct answer is option D, all of the above. Question 104. Peggy is a home health aide. Today, while Peggy is helping a client, her son's teacher calls Peggy on her cell phone to tell her that her son has had an accident on the playground, and he needs to be picked up. What should Peggy do? Option A, tell the client that she has a family emergency and she has to leave. Option B, tell the teacher that she will be there to pick up her son after her shift ends, in another 2 hours. Option C, call her supervisor and ask if there is another aide who could cover for her while she goes to pick up her son at school. Option D, take the client in the car with her to pick up her son. The correct answer is option C, call her supervisor and ask if there is another aide who could cover for her while she goes to pick up her son at school.